Drug overdose rates in the Midwest are rising, but little research exists on rural drug use trends. We look at efforts to learn more and explore the limited options for drug addiction treatment in rural areas. That's tonight on Speaking of Nebraska. Thanks for joining us on Speaking of Nebraska. I'm NET News Director Dennis Kellogg. As much of the nation battles a growing opioid addiction epidemic, the problem has been slow to make it to this part of the Midwest. Yet the rate of drug overdose deaths has nearly doubled in the last 10 years, from about 4 deaths per 100,000 people in 2006 to more than 6 in 2016. Nebraskans in rural areas have about the same access to drugs as in urban areas. Across the state, about 9% of adults with steady housing say they know at least one person they can get methamphetamine from. 4.5% know where to get heroin, and nearly 18% say they know how to access prescription pills. But treatment options are limited. Joining us now to talk about rural drug treatment efforts are Kirk Dombrowski, Director of the Rural Drug Addiction Research Center, and Tommy Newcomb, Executive Director of the Connection Project. Thank you both for coming in.
Thanks for having me.
So I guess the big question is there a difference between drug use in rural areas and drug use in urban areas? Kirk, we'll start with you.
We don't necessarily find differences in access to the kinds of drugs that people have access to, or to how they're using drugs. We do find in rural areas a higher level of polysubstance use. That is, people will go from use different kinds of substances at different times, either in combination or sequentially. And for a long time, we thought that was due to differences in drug availability, but it doesn't necessarily seem to be the case. It seems to us it's more likely these days from our research to be the result of different social patterns and different ways that people come into a substance abuse scene, and who they're working with and who they're hanging around with.
Tommy, what kind of differences do you see rural versus urban?
Honestly, I don't have a lot of contrast there. I have a lot of experience with rural drug use and not any with urban areas. I grew up in urban areas, but never was introduced to drugs. So
Right. Well, when it comes to drugs, and when you look at Nebraska, what are the drugs we're talking about? We hear a lot nationally about opioids. Is that the main concern in Nebraska, Kirk?
Here, the larger issue is methamphetamine use. We have a rising opioid use rate, but compared to a lot of other parts of the country, that isn't a big deal. But Nebraska rates right now about 8th in per capita treatment admissions for methamphetamine in the United States, and our neighboring states are also very high. Iowa is very high, number 1 in the country. So that seems to be, in terms of illicit drug use, our biggest concern.
Now, Tommy, you said that in this fight we need to involve experts that are experts in another way, and that brings us to a phrase, nothing about us without us. Tell us a little bit about what that means and how that is used in drug treatment.
yeah, so I think the idea that so I have a lot of personal experience with using substances of all different kinds, and I also have a lot of personal experience with being in recovery and coming through that. So in a lot of ways, I'm very much an expert on drug use and recovery from substance use challenges. And I think that having a voice at the table is super important, not only for to give ideas of what works and what doesn't work, but also for my own wellness. Just being able to speak out, it's really important to be able to do something positive. But yeah, just the idea that there's a lot of people that maybe don't have that firsthand experience that are making decisions that affect people that live in that, just in those spaces that live, using every day, and there's all sorts of other things going on besides using that maybe aren't understood by the people making policies, if they don't have that firsthand experience. So we need a spot at the table, and not just a token spot, but being able to really speak to what works, what doesn't work, and things like that. From a different perspective.
Yeah, it makes sense. People who have had that experience have insights that probably other people don't. So we're talking about peer support. It's a growing treatment option. And here in Nebraska, a person with addiction experience can get certified as a peer mentor. Danielle Smith is project director for the Nebraska Coalition for Peer-Directed Services, and she explains how peer support works.
So lived experience, connection, mutuality, and also thinking about advocacy. I think those are huge pieces. And also kind of giving an individual that's in recovery a chance to be a professional in the community and help others that are in recovery. We're really working on workforce development. If you're in recovery and you start doing really well in your recovery, then you can support another individual in recovery as well.
So Tommy, can you talk more about peer support and why that's effective?
Yeah, so I guess why it's effective is there's a ton of reasons, but I think a big part of it is that mutuality that Danielle was talking about in that clip. The idea that I think sometimes in traditional behavioral health services there can be a little bit of learned helplessness, or people don't get a chance to take personal responsibility for their own wellness, and peer support kind of combats that, and it doesn't come at a person from the perspective of, I'm an expert and I know what is wrong with you and what you need to do to fix that. It doesn't look at people as problems, it looks at people as people, and gives a chance to kind of explore, just explore wellness and different dimensions of wellness, instead of just focusing on the problem of addiction or drug use. I think it's a lot asset-based, strengths-based, which really builds on a person's self-esteem and self-acceptance. Like Danielle was talking about, it's all built on connection, worldview, mutuality, and moving towards the idea that we can build relationships and be a part of community. It's been huge for my wellness that I went to a treatment, but what's really kept me well and given me a chance to thrive is the idea that I can participate in life, in the community, and I have supportive relationships around me. Just like anyone, but that doesn't get held out to addicts a lot of times, because the focus is on, we need to stop you from using, and really what helps maintain that then is to have supportive, constructive relationships, and that's what peer support does.
Kirk Dombrowski, the director of the Rural Drug Addiction Research Center, and as the name implies, you've focused a lot on research, but it doesn't seem like we have a lot of research on rural drug use patterns. So why is that, and are there gaps in information out there that we really need to find?
Absolutely. For a long time, drug use was predominantly an urban phenomenon, especially when we're talking about, heavy illicit drug use of things like opioids, heroin, and the like. Rural drug use for a long time meant alcohol, and that wasn't necessarily a large focus of addiction research in the same way that we're facing it right now. So there have been a couple of projects that have really sort of helped give us some baseline information out of Kentucky and Appalachia, and some work in rural New England. But for the Midwest in general, there's very little research that's been done, and that leaves us wondering a lot. We don't know what kinds of supply, what kinds of use, what kinds of patterns, what kinds of social networks, and we don't know what kinds of risk are involved in that. So illicit drug use carries certain kinds of risk, particularly if it involves injection drug use. And without that kind of background information, you can be caught really off guard. That was the case a number of years ago in Scott County in Indiana, which was a town of only about 4,000 people that in the course of several months saw several hundred people diagnosed with HIV. It was something that no one saw coming, and we really weren't prepared for. So in order to try and get a better grip on those risks, risks around addiction, around overdose, around disease transmission, around treatment need, all of those things. We actually need much better specific local data, and it's just not out there for the Midwest right now.
And does the research show that here in Nebraska, in rural areas, we need to be concerned about things like HIV and hepatitis C?
So hepatitis C rates for our testing right now in Nebraska are very low, same with HIV, but that's in large part because folks who are in the illicit drug use community are not being tested. And so we actually don't have the data on things like hepatitis C rates among injection drug users. We know that from some of the excellent work that's been done at the VA and Kathleen Grant up at UNMC, from small samples, that hepatitis C rates are likely to be chronic rates of 30 to 40%. We'll have exposure rates maybe as high as 50%, and that would be accurate to a lot of rural areas in the United States. And this is a huge public health risk, just sort of sitting out there, undiagnosed, untreated, and really unacknowledged. You know, this is not a general population phenomenon, but specific to the illicit drug use population. That's a really big issue.
So we know nationally opioid addiction is getting a lot of attention from the federal government. They've incentivized opioid treatment, but meth and alcohol probably impact more Nebraskans than opioids.
Absolutely.
So what is the right balance between addressing the growing problem like opioids and addressing an ongoing problem like meth? Tommy?
I think, I guess, from my perspective, the solutions are really the same across the board in that, you know, focus on community and community-based programs are the way to go, and looking at I think like law enforcement and the reaction that law enforcement has to drugs and the stigma in communities and things like that, and getting so people don't get tested for HIV because you can't say that you use drugs, you know, because there's such a stigma against it, and so those types of things get addressed the same way, I think, no matter what the substance is. I think the money should be spread more evenly, I guess, instead of just focusing on opioids. Although I've noticed a lot of talk about things like fentanyl being mixed with everything under the sun now, and so that's really scary. People are overdosing, you know, with not even knowing that they're doing opioids. So yeah, I guess, yeah.
Well, when it comes to opioid addiction, some medications are out there that can help with that treatment. Lindsay Hanlon coordinates the state opioid response for the Nebraska Division of Behavioral Health. She says that these medications work by lessening withdrawal effects.
We do know that it has been proven more effective when somebody has been on medication-assisted treatment and continued that process, however long that may take. It's such an individualized process, but they tend to have fewer relapse rates than those who just do the abstinence only and don't have any sort of ongoing therapy or touch base with their provider.
Medication-assisted treatment is one of the most effective, but it's also not very accessible in rural areas of the state. There are 54 active prescribers in the state, but most of them are clustered in Omaha and Lincoln. So what does that distance mean for Nebraskans who are in rural Nebraska trying to access that treatment, a lot of which is in the eastern half of the state? Kirk?
Sure. So traditional treatments like methadone or more contemporary treatments like buprenorphine require an actual doctor visit in order to receive the prescription. And for something like methadone, it's daily. For buprenorphine, it's limited amounts because of the potential market value of the drugs involved. And so for folks who are living 200-300 miles from a prescriber, that's in effect zero access if you would have to do that every day. And so we find in western Nebraska that people are far more likely, people are driving from South Dakota to Denver for treatment. We know this is a region-wide problem, and that's a real problem because the medications are effective. And we know that the relapse rates for opioids as well as for methamphetamine on abstinence only are less than a week. Just 80% of people will relapse in less than a week. With buprenorphine, with methadone, the relapse rates drop to around 50% in 6 months. That's a dramatic difference in treatment effectiveness. But if you can't get it, then you're left with one option and one option only.
Tommy Newcomb is the executive director of the Connection Project. And Tommy, I want to ask you, I want to switch gears a little bit, talk about substance use disorder as a crime versus a health problem. And so what is it? Do we treat it as a criminal offense, or do we start to treat it as a health issue? Which way?
Well, I don't think it's ever worked very well to treat it as a criminal offense. You know, ever since the 80s, when really the war on drugs started, and it never has been very effective. And I've also got plenty of experience with the criminal justice system due to drug use. And I'll tell you, anything that I've ever learned by being involved in that system was more about using and hiding my using than it was about getting better and getting over it. And so it needs to be definitely treated as a health problem and as a wellness problem, and not a criminal problem. I mean, there's been some success in places like Portugal that went to a real extreme and got rid of, you know, criminalization of all drugs, and you know, they have less people die. And I think that's pretty important to have less people die. Mm-hmm. You know, no one's going to seek help if you are afraid of going to jail for saying you have a problem. It's a lot like suicide conversations. If someone feels like they want to die, but they can't say that they want to die, then they can never there can never be help for that. And you know, I think it's a lot the same with drug use, and people are dying because of it. And you know, they're not gonna seek help if they're treated like criminals.
Can I follow up
You
on
bet,
that?
you
So
bet.
there's you know, where this has been really effectively done, law enforcement has actually led the way in changing attitudes about the criminality. So you know, places like Gloucester, Massachusetts have the Gloucester model, where you can go in, put your drug paraphernalia, put your drugs on the counter in the police station, and you'll be taken for treatment and not put in jail. And that kind of change on behalf of law enforcement actually has led to a tremendous amount of people getting into recovery faster. And where law enforcement has sort of grabbed onto this concept and led the way, we see really great results. So, you know, it can happen. It can happen locally, it can happen nationally.
Like with syringe exchange programs, that's maybe one option. Drug courts, potentially another one?
Sure. So syringe exchange is a really critical issue, number one, for preventing disease, and number two, for keeping regular contact with people who are in an addiction state and need help. They may not need it today, but if they have someone who they know they can count on for a clean... And look, syringe exchange is not just syringe exchange. People deliver toothbrushes, they deliver sandwiches for kids, they deliver... those programs are sort of care, right? And the idea is with clean needles is that you keep people from making each other more sick than they already are. But in the process, you have daily, regular kinds of contact with a community that needs a lot of help. And so when people are ready to make a change, when people are tired of the life that's really kept them where they are at, they immediately have someone that they trust and they know that can connect them up with services. So where we have successful syringe exchange, we have better treatment, we have lower disease spread, we have better recovery rates. It's that simple.
In rural Nebraska, for example, Antelope County, I've done a lot of work in Antelope County Jail, going in there and providing peer support services, like doing wellness recovery action plan groups and things like that, and it makes a huge difference too.
All right, so we could talk about this for a long time. Great conversation, though. I appreciate you both coming in. Tommy Newcomb with the Connection Project, and also Kirk Dombrowski, the Rural Drug Addiction Research Center. Thanks to both of you for your expertise.
Thank you very much.
This interview and tonight's program are available on our website. Just go to netnebraska.org/Speaking of Nebraska. The international trade outlook has been bleak for months amid President Trump's trade war with China, but tariffs are just one part of the equation. American Farm Bureau President Zippy Duvall spoke in Lincoln recently about how farmers across the country are feeling.
And we'd like to get our markets back, because that's what farmers want. We want a level playing field. We don't want government checks. We want open markets. And that's what American Farm Bureau is trying to help develop policy that'll bring that.
Joining us now to help us understand this complicated issue is Jill O'Donnell, the director of the Yider Institute on International Trade and Finance. Thanks so much for coming out.
Thank you. Happy to be here.
Let's look at the trend over the past few decades. You've got a move towards lower tariffs, and ag is becoming more protective, so therefore you're looking to expand export markets. It seems like today we've kind of flipped that around a little bit. How are we dealing with it?
Sure. So as you said at the outset, trade negotiations used to be almost entirely focused on reciprocal tariff reductions, numerical reductions, but that got a lot more complicated over the subsequent decades in the post-World War II period as agriculture got more complex, more productive, and new barriers to trade, such as plant and animal health regulations, for example, can cause difficulties in farmers moving products across borders due to policy differences in other countries. So a lot more complexity on the table when it comes to those negotiations and opening up trade. As for how we're dealing with it, it's definitely a complex time these last couple of years. And I think that the U.S. and others around the world are trying to find a new normal and a new footing for trade, and that's for a lot of reasons. China's economic rise is definitely a major trend impacting the trading system that we have, and you're seeing the U.S. taking certain measures in terms of how to deal with that right now, and other countries coming together in other ways to come up with proposed solutions in other areas for trade. So a lot of complexity to watch.
It is, and you talked about China. President Trump announced this week what he's calling phase one of his trade deal with China. The United States halted tariffs on $250 billion worth of Chinese goods that were supposed to go into effect this week. In exchange, China's agreed to buy up to $50 billion in agricultural goods from the U.S. in the next 2 to 3 years. So is this progress? And if so, is it significant progress?
So on your first question, is it progress? I would say yes, it is progress. Anytime there is a halt or a freeze in tensions, that is a good thing. I would point out that the tariffs that were supposed to go into effect that did not take effect this week, that the U.S. had been planning to impose, is positive, as well as the agreement potentially by China to purchase up to $50 billion in U.S. farm goods is good news for farmers. However, we don't know over what time frame exactly that would play out. So as to your question, is this significant progress? I think that's difficult to say at this point. It's important to remember that these details aren't finalized. We've not seen official paper on this yet. Potentially President Trump and President Xi Jinping of China will sign this phase one deal a month from now at a summit of the Asia-Pacific Economic Cooperation Organization, but we don't have all of that finalized just yet. There's still a little uncertainty surrounding the details.
So the Nebraska Farm Bureau estimates that the trade war has cost Nebraska producers nearly $1 billion last year, could cost another $1 billion this year. But there is some signs of hope. The U.S. trade delegation is in Vietnam this week. Governor Ricketts has visited Vietnam. Is it possible to have some other countries like Vietnam step in and take up some of what we're losing from China?
That is possible, and you have seen some U.S. farm exports going in larger quantities to other places like the European Union, like certain places in Africa. But I think that China was such an important export market for U.S. agriculture. Soybeans are a great example of that. Over half of U.S. soybeans in prior years had gone to China, that it's difficult to recover that lost ground by sending goods to other countries very quickly. China is likely to remain a really important source of demand for U.S. agriculture, so that's not going to be easy to make that up on a quick time frame.
And just a few seconds left here, but we have to remember that there are some manufacturers in Nebraska that are getting hit on both sides of the equation, those who deal with agriculture.
Right, so it's important to remember that when tariffs are imposed by the U.S. on other countries' goods coming in and vice versa, a U.S. company can get hit on both ends, making it more difficult for them to sell their goods abroad and also reducing demand for their own goods. In the ag space, for example, if farmers have more uncertainty with respect to their cash flow, they may not decide to buy that combine or other type of equipment. So a company can get hit both ways.
Absolutely. We're going to continue to follow it, and thank you so much for lending us your expertise today.
Happy to be here. Thanks.
It's Jill O'Donnell, Director of the Clayton Yeutter Institute on International Trade and Finance. If you have questions about international trade, ask us on social media. You can find us on Facebook and Twitter at NET News Nebraska. This summer, a century-old irrigation tunnel collapsed in Wyoming. That cut off water for hundreds of farmers, both in Wyoming and Nebraska, where more than 50,000 acres of farmland depend on that irrigation water. Fred Knapp of NET News has been following the story. And Fred, can you describe exactly where we're talking about?
Yeah, this is a tunnel. It was built in 1917, and it's part of the Gering-Fort Laramie-Goshen Canal system that takes water from the North Platte River in eastern Wyoming and sends it more than 100 miles to just south of Gering, Nebraska. And as you said, it irrigates about 52,000 acres in Wyoming and 57,000 in Nebraska, all south of the North Platte River. And it helps farmers grow alfalfa, dry beans, corn, sugar beets.
So this is a tunnel that just kind of collapsed on itself?
Yeah, part of the roof collapsed on July 17th, and so tons of soil dropped in and blocked water from getting through the rest of the canal system. And it took a huge effort to fix. I mean, they had to remove like 100 feet of soil on the top of the tunnel to relieve the pressure. And then they had to burrow in to the collapsed section of the tunnel, installing steel supports as they went. The problem was this hit at the peak of the growing season, the hot summer season, and water was finally not restored until August 28th.
So what was the effect then? Because that water was out for quite a while. What was the effect of it?
Yeah, a little over a month, and it was a big hit on the economy because of the reduction in crop yields. There was an early estimate that the overall effect on the economy in the region would be an $89 million loss, but that then was alleviated to some extent.
So are there some resources out there for these farmers who have suffered these huge economic losses?
Right. The USDA ruled that because the heavy spring rains contributed to the tunnel collapse, that it was a weather-related event, and that meant that crop insurance would kick in. But even with crop insurance, that still only covers about 60 to 70% of what farmers had been expecting. We won't know the full cost until all of the harvest is in and the crop insurance calculations are completed.
So you've got this catastrophic irrigation tunnel collapse that has now happened. They've come up with some sort of solution, but what's ahead for the future?
Well, it's just a temporary fix, what they have now, and it cost about $8 million. But long term, I've heard estimates ranging anywhere from $12 million to repair the existing tunnel to up to $88 million to dig a new canal around the hill that collapsed. And so they need to nail down these costs. The local irrigation districts have to decide. And then there's still a question of how much of the share the local farmers have to pay. The state might chip in something, and the feds might assume some responsibility.
So I'm guessing farmers in western Nebraska are going to be keeping a close watch on how this all develops.
As will we.
Thanks, Fred. Fred Knapp of NET News, and you can find Fred's reporting and more with our daily signature stories on NET Radio. This week you'll find stories about the need to train court interpreters for the growing population of residents who speak limited English, and an artist traveling the country to celebrate the ratification of the 19th Amendment 100 years ago. Plus a story addressing the increase in stolen weapons and the consequences when they're taken. Those stories and more on our website at netnebraska.org/news. That's all for this week on Speaking of Nebraska. Thanks to Kirk Dombrowski, Tommy Newcomb, and Jill O'Donnell for joining us. Next week, we'll take a peek into the future of public libraries. Until then, I'm NET News Director Dennis Kellogg. Thanks for watching.